Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Today on Wellness Wednesdays, I'm going to be talking with you about some general things you can do to improve your overall foot health, as well as about a common thing that many people suffer from, which is bunions. The feet are the foundation for the entire body, and they provide the structural support to allow you to walk and run and participate in your hobbies as well as your general day-to-day activities. When they're thrown off, you can develop pain in your knees, hips, and even back. Some of the issues that people suffer with in the feet can include chronic tendonitis, arthritis, foot deformities to include flat feet, very high arches, and even bunions. And all of these can throw off your gait and your alignment of your legs. One of the most important things that you can do for your feet overall to make sure that they have a good, healthy foundation is to wear good shoes. It's very important to have a shoe that's not too flimsy and cannot be bent in half easily and is very solid. Also important that there is good built-in arch support, or if there is not, that you add in a special insole to provide support for your arch in your body. It's important to seek out care for your foot problems and your foot pain. If you've already tried some conservative options to include over-the-counter medications, icing, heating, as well as making sure that your shoes are not worn out. That's a very common problem that people have and they don't realize. If this is still causing you pain after that, it's important to get a checkup, to have x-rays and a good physical exam so your doctor can help you improve your pain level and your activity. One of the most common conditions that I see and treat is bunions. And what a bunion is when the bones to the big toe shift out of alignment. This then creates a very painful bump about your big toe and makes it difficult for shoe wear as they rub on the big toe and they become very tight. Some early signs that you may be developing a bunion is that you notice there's a prominence, some swelling, or even redness near the base of your big toe. You also may be noticing that your big toe is starting to shift and move and pinch into your second toe. Non-surgical treatment for bunions is to make sure your shoe wear is appropriate with a solid base and good arch support. It's also extremely important to have an extra wide, extra depth toe box with stretching material that's not too constraining. You can also try toe spacers, which help realign the big toe, but nothing will realign the bones to your big toe without surgery. So once non-operative care has failed for your bunion, including shoe wear modification and toe spacers, it's important to talk to your surgeon about surgery, especially if your big toe is starting to change the alignment of your other toes or you're getting any wounds or infections. Surgery is to realign the bones to the big toe. Sometimes we break them, sometimes we just align them, but we'll need to use hardware to hold them into the new place so they can stay straight and improve your shoe wear fit and pain. If you're worried that you may have a bunion or your life is becoming impacted because your toes are making it difficult to wear your shoes or you're developing wounds or blisters, it's important to have your feet checked by an orthopedic foot and ankle specialist for x-rays and for them to perform a physical exam, because there may be many things that they can do, non-operative and operative, to improve your pain and increase your activity level and the things that you love to do.